Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. Even in these very grim and tense times, one of the optimistic developments has been the number of citizens' initiatives that we have seen. Right now, we're in an ambulance headed into one of the settlements of Mumbai, and this is being run and supported entirely by a citizens' initiative, which is the Maharashtra builders and developers coming together, and this is the BDS Initiative, and we are inside an ambulance with two young doctors and one of the patrons of this initiative. So remember, we also need to focus on what people are doing to chip in at this point. Let's get a sense from the doctors about what we're going to do today. May I know your name?
I'm Dr. Kavita.
So Kavita, tell me a little bit about yourself.
I'm Dr. Kavita. I'm currently working in Nandani Hospital, Powai. And many of our doctors have come together to volunteer in this support because we started a very good initiative as such.
And where are we going right now?
Ma'am, we are going to Andheri now. It's a slum kind of area over there. So we are expecting at least 500 plus patients, hopefully that's right.
So we're going for testing?
Yeah, we are going for the screening.
And tell me about yourself.
Hello, I'm Dr. Priya Verma. I'm a dental surgeon. And in this pandemic, I'm just giving an ode to my nation by giving my service as a noble service. And we have a group of doctors who just go to the camp, screen up the patients and just suspect, and we individually we divide them. So it's a contribution for us to other service and to other professionals.
Now, what's really important to understand is that this is a time when Mumbai's hospitals are overburdened, and it's really important that you minimize the number of people going to hospitals for anything, which is why it's so important that the dispensary actually moves into areas rather than the areas people moving towards hospitals. Now, of course, when we reach there, you're going to get into full PPE kit. Yeah. Talk a little bit. I've worn a PPE kit to enter COVID wards, and I have some sense of how difficult it is, but talk a little bit about the human side of what it actually feels like.
Actually, we have different kinds of PPE kits. So the PPE kit which we are wearing is light DGSM plus. So the moment we wear it, it's like we don't have any oxygen coming inside, and we are actually drenched with the sweat of us. And on top of that, we wear the N95 mask also. So it should be so tight that you cannot even breathe. The air should not go. That is the basic thing which we have to do. So when we have worn that thing, we can't even have a sip of water. We cannot even lift that thing. We cannot do anything. So if 4 hours, 5 hours, we are there in that thing, we have to wait for that 4 hours in that.
And how does that feeling, how would you describe that feeling?
It's like we are in a hot oven. Inside an hot oven, we are just sitting there, we are just roasting inside that because we have nothing there. We don't have any AC or anything. So we just need to get rid of that thing. But still we have to do our work. That is the main thing which we do in that.
How does the PPE feel to you?
It feels like a closed box. It feels like anything just, and then the box is suddenly open and we get to breathe.
Yeah. I know exactly the feeling, and I think people don't appreciate. You think the PPE is protecting our doctors and our health workers, and of course it is. But the point is, it's also really, really difficult to wear. So let's take a look outside. We're driving through the streets of Mumbai, and we're going into one of the crowded, congested areas. Now remember, one of the reasons it's so difficult to contain the pandemic in cities like Mumbai is precisely because of the congested areas. And let's come here and talk to somebody who's actually supporting this initiative. And like we've said, one of the great things about this moment is the number of citizens' initiatives that we're seeing. Tell us a little bit about how you got involved in this.
So there is this gentleman called Shantilal Mutaji who started this movement. He has an organization called BDS in Pune. He was doing very well. And when we learnt about it and spoke to him, because he's our old friend, we realized that this is something that Mumbai needs very, very desperately. That's when we got together. We have just now more than 50 vans on the road, 15 in Dharavi, 35 going to different areas because the slums and the slum dwellers need this desperately. So what we are trying to do is, one, give them medicines for basic needs of theirs, so cough, cold, fever, some child is sick, those kind of things, and diagnose it. The medicines what we don't have, we kind of prescribe to them what to do. And more importantly, we are trying to find the people who we suspect are COVID patients, and we give that list to the corporation. So the Mumbai Municipal Corporation, we give them the list and then they take it from there.
Now this is a number of developers and builders coming together in this.
Yes, so we have an organization called CREDAI MCHI, which is the Maharashtra Chamber of Housing Industry chapter. And we are doing it under the auspices, this.
What made someone like you, who's a private citizen, step in at this moment?
So this is what we owe to the nation. This is absolutely the need of the hour, and we need to do whatever we can.
As a Mumbaikar, what worries you most about the situation today?
Today we are worried because it's still not abated. It's still going on, and the way we are seeing cases go up, it is a cause for concern for sure. And we need to do whatever we can. And I'll appeal to everybody to come forward to do whatever they can. The doctors, the volunteers, they are outstanding.
One last thing before I actually speak to the ambulance driver as well. This is a time when the hospitals are overcrowded in Mumbai. So, how do you encourage fewer people to go to hospitals? That's one of the things that this van is serving a purpose of. That you're taking the hospital to the people.
Yes, we are absolutely taking the hospital to the people in a small way. We can't solve all the problems. In fact, whatever surgeries or anything else that is required, we can't do. But basic care we are trying to provide to so many people. So, as an organization, we've done more than 1 million patients seen till now. In fact, in Mumbai, in the last 30-40 days, we've seen 300,000 patients. So that's the kind of reach this has. So each ambulance or each van takes care of about 300 odd or on an average people and patients every day.
That's fantastic. And volunteer initiatives, thanks Mr. Shah. Volunteer initiatives like this one are really, in a sense, what's keeping the city together. And you can see here that the doctors are actually going through the list of people that they have to visit today, the list of areas, and you can see the doctor going through that list. But unsung also in this situation are the ambulance drivers. These are not people who have to do this. These are people who are doing this as a service. Sir, जी, आपका नाम?
सीताराम दास।
और आप क्या करते हैं वैसे? क्योंकि एम्बुलेंस तो नहीं चलाते वैसे।
नहीं, स्कूल का गाड़ी चलाता हूँ, लेकिन अभी फिलहाल इधर लगा हुआ है।
तो अभी जब आप रोज जाते हैं हॉट जोन्स में, थोड़ा डर लगता है?
हाँ, डर तो लगता है, लेकिन
फिर क्या सोचते हो? दिल में क्या सोचते हो?
अभी तो भलाई के लिए करना पड़ेगा ना।
घर में बच्चे हैं?
नहीं, शादी नहीं किया अभी तक।
सबसे ज्यादा डर क्या लगता है?
अभी तो कोरोना का ही फिलहाल डर लगता है।
So you have here Sitaram, who says that look, I have to do what I have to do, but it doesn't mean I'm not scared, and we should also acknowledge what ambulance drivers are going through. Tell us a little bit about the emotional roller coaster that doctors in Mumbai are feeling right now.
Emotionally, they are skipped out. Either we should opt or not. So it's a quite severe decision for the doctors because they are at risk. They have their family, they have their relatives on their own. So it's not a single decision, it's a decision taking the family into consideration. So if a doctor is opting for something, they have to look back for entire family, entire relatives, entire neighborhood, because it's not a single decision. It's a society decision plus the dentist decision.
Do your families worry for you?
Yeah, ma'am. They are actually.
What do they say?
Actually, in a way, they are happy that we are doing something. But the moment they come to take care, everything went good. Did you get how many positive patients were there? They are more concerned कि कुछ अच्छा हो रहा है कि नहीं. That is the first thing which they ask. Everything has gone fine.
Are you worried about going back and meeting your families?
At times, yes. At times, yes.
How would you describe your state of mind right now?
That is a very difficult question to answer, actually. It's like we are happy that we are doing something for our country. But in that way, plus we have that fear with us that what if we go home and what if something happens to us, what our family will go through. So that's a different thing. Like we have two sides of a coin kind of. We are doing this something for good, and plus we are also scared what is going to happen to us.
It's just the motivation from the parents. It's like my mom, she waits until I leave and she waits till I come back. So she has a smile on that face that she is worried. I know definitely she must be thinking that you're okay, right? That's the only thing she wants to hear from me.
How old are both of you?
I'm 26.
I'm 33.
So very, very young women doctors at the front line along with the Citizens Initiative. We've seen the builders and developers of Mumbai, and I think we're waiting to get into the area and we're going to go into one of these areas. The doctors are going to get into PPE and we're going to basically follow them as they try and get more and more people to line up for tests, and we take a ride on these doctors who are on ambulance duty, powered entirely by a Citizens Initiative here in Mumbai. The ambulance has arrived at its first destination, a congested slum tenement in Juhu. It is time for the doctors to get into their PPE or protective equipment. The ambulance is already sanitized, so it's safest for them to wear their gear over here. The hazmat suit that suffocates, that feels as hot as an oven, to quote the doctor, but is a lifesaver. Inside the slums, it begins with a trickle, but soon it is a stream and then a flood. So here we are in Hadewari Chaul in Juhu Gully, and you can see that the doctors we were traveling with in the ambulance are now in full PPE and people are lining up to get tested. We are seeing at this point this elderly lady here who is getting her oximeter. Is that an oximeter? So, Doc, can you tell us what's actually happening here right now?
I'm just checking her oxygen saturation rate, whether if it is 95 up, then she should be fine. And just I'm asking her what any other problems.
Because she's also elderly, so she would be the vulnerable
Yeah,
group.
that's right. That's why I'm just asking her if she's having any issue while breathing or something, because they might not know. They are elderly, they might just say that I'm having difficulty, but this oxygen saturation, we can at least come to know if really she has any issue as such.
So I hope she's okay.
Yeah, she is fine. She's perfectly okay.
आप ठीक हैं? ठीक है
एकदम मस्त है तुम्हें?
टेस्ट कराने आए थे
हाँ
अम्मा टेस्ट कराने आए हो
हाँ
तबीयत ठीक है
हाँ
So she seems okay, right?
Yeah, she seems okay.
So this is thank God, because the elderly are among the most vulnerable, and you can see she's hunched over, literally hobbled her way here, got her oxygen meter reading done, and the doctor says that she's absolutely fine. These are all women lining up here to be tested. And remember, this is a city that has extended its lockdown now till the 30th of June, and it has congested areas like this where the phrase social distancing absolutely has no meaning. If you take a look right there, that's how narrow and congested some of these gullies are, and there are more women coming out to be tested. Test karane aa rahe ho? No. टेस्ट करा रहे हो? हाँ? थोड़ा डर लग रहा है? डर नहीं लगना चाहिए, लेकिन टेस्ट कराना अच्छा बात है ना? So we have to also remember at this point that this city has become an epicenter for the pandemic, and citizens' initiatives like this one do need to be celebrated. It is a moment of people coming together to help each other out. This entire initiative is being financed entirely by citizens. So, we're seeing the response here, number of people now lining up to get tested. How are you raising the funds for this?
So we have a lot of donors coming forward. We also have our own funds, but fortunately we didn't need to dip into our reserves because all the donors have come forward. So the first person who very graciously came forward is Vallabh Bansali. He has a foundation called Desh Apnaye. So he came forward saying that I will sponsor the first 25 vans for the whole month, and that's how the momentum started. Then all of us as developers pitched in, with.
So how much are you spending on this? Because I do think it's important for people to understand what kind of money goes into running this.
Each van that we spend, it's about 4.5 lakhs a month that we spend on each van.
And how many vans are you running in Mumbai?
50 plus now, and growing every day because of the Dharavi.
So support citizens' initiatives like this. We've all heard of the more famous individuals like Sonu Sood. I've personally covered him. But there are many citizens' initiatives like this one that is making it possible for Mumbai to hold together at this moment of crisis. We decide it's a good moment for us, after 2 months of being on the road, to perhaps be screened as well. The result? To borrow the good doctor's words, ekdam mast. And thank God for that.